Good afternoon, ladies and gentlemen. It has often been said that the intelligent man speaks because he has something to say. A wise man speaks only when there is something to say. But usually a moderator or a chairman of a session is compelled to say. And that's my role that has been assigned to me by Dr. Vijay Agarwal and the team at CAHO. I'm very obliged and grateful to Dr. Agarwal and the team for inviting me for this session. The reason why I say that I'm neither intelligent nor wise is because of the number of speakers who have been assembled here to speak are really very big names. And it's an honor and a prestige to have them in the CAHO session today. Ladies and gentlemen, India is some country that you all know is consumed with quality. Now that was a pun. We actually are consumed by quantity. The world knows us because we are 1.3 billion people. People talk about us having so many patients, but so many shortage of beds. We talk about the deficiency in the number of doctors, number of nurses. Dr. P.C. Reddy always said, double the nurses, double the doctors, triple the nurses, and quadruple the paramedics. Every time that you hear there is talk of quantity, very little is mentioned about the quality of care that is being provided by the institutions or by the doctors or the nurses. At the same time, if you were to ask a patient, his primary objective or focus is the quality or the ultimate outcome of care. So there is a huge dichotomy here about what we are talking about or the media talks about, even we as doctors and institutional members talk about, and what the public actually is expecting from us. You take the example of Ayushman Bharat, the latest scheme that has been launched. You're talking about every time you read in the newspapers, even the statement from the National Health Authority would mention so many lakhs people treated, so many cataract operations done. Is there ever a mention of how many of those cataract patients went blind? How many got infected? But don't you think that's the most important thing that the patient is looking at? That am I going to get better? Am I going to get out of the hospital? A, so survival. B, least amount of post-operative problems like infection. And 3, relief from pain and discomfort. So there is a facet of life that is the quality of care and the outcome of care that pervades the thinking of a patient, but somehow it escapes a common person's perception when he or she goes to a hospital or when the media reports about it, either social or otherwise, or even our films, which carry messages subliminally, sometimes very, very loudly. And it's so inspiring that we are meeting in Bombay for this reason, that 2 of the films that depict the medical profession in excellent light came from Maharashtra. One that I remember was Dr. Shantaram's movie, Dr. Kotnis Ki Amar Kahani. And recently, last year, I think, a Marathi film on the first woman doctor of India who died at the age of 22, Anandi Joshi. And that movie in Marathi was a hit. So movies have this capacity, like the media does, of projecting a part of the medical profession like no one else does. Despite wanting good quality and outcomes, most of the time our patient population is not aware what goes into providing that quality by the medical profession, by the institution, and perhaps we ourselves are to blame that we've not focused so much on the quality of care, consumed as we are with the quantity of it. Secondly, probably the media also owes an explanation to us, as do film people who probably haven't been role models or haven't taken this responsibility of focusing on what is the possibility of what the patient actually wants out of the treatment that he or she is getting. That there is a time, manpower, and resource around which, and there is a cost involved to it, is ill understood by the patient when he or she wants to get treatment. It's often said that quality is the 3 A's, and the first A in India will always be affordability. When you have 5% of India's population annually going into debt or actually having mortgages, 5% annually is a huge, huge number. And we somehow don't get it that this affordability is actually increased because we are not prepared to pay the cost of quality. In today's world, media and films affect our psyche a lot. Whether it is social media, it is radio, it is television, it films, they all add to a perception, and they have the power to mold opinions. Have they been well utilized by those that control the media and the films, and even by us, who probably not have the kind of interactions that we need to have? Ladies and gentlemen, there was a time when religion was strong and science was weak. That was a time when human beings mistook magic for medicine. Now, when medicine or science is strong and religion is relatively weak, man or humankind mistake medicine for magic. There will always be medical errors. We have 13,600 medical diagnoses. We have over 6,000 drugs, and we have over 4,000 procedures. Surely, somewhere, something can go wrong. Medicine cannot be a magic for all. There are limits to what can or cannot be achieved. But it does not mean that medicine does not owe to itself, to its patients, that safety is not compromised. The trouble is, a lot is said and done, but very often more is said than is done. And that is the tragedy of the current situation. We felt, when Vijay and I were discussing this, we felt that it would be wise for us to listen to some of those who are public figures, whose voice matters. And therefore, we have a very distinguished panel, one of whom is a film actress of yesteryears, a woman known for her acting prowess, her beauty, and today better known as a person who has undergone treatment for oncology and has made for an oncological problem and has made it her point or almost a mission in life to try and talk about it. The other is an equally famous person who all of you have heard, and if I do not call him on stage, the nation will want to know. I refer to my friend Arnab Goswami. He is from Delhi University. So, Arnab, I remember seeing him when he was in NDTV. I think he had come from Calcutta. He's a bachelor in sociology from Delhi University, did his master's in social anthropology from Oxford. He's been a visiting fellow to Cambridge University. And, well, what can I say about him? You probably see him every night. And the passion with which he conveys his feelings, his innermost thoughts, is something that I, having spent 49 years in radio and television, really admire. I'm doubly delighted, Arnab, to welcome you as, shall I say, a quack, semi-professional. You are a professional. The lady that I referred to, who you would probably have guessed whom you're going to listen to, is Sonali Bendre. She's with us today. Sonali makes you still, if you look at her, you still feel like that movie Sarfarosh, and you start feeling that if only you had Jagjit Singh's voice, you will be singing that famous ghazal of Sarfarosh. So Sonali Bendre made her debut in the Hindi film industry in the 1990s. Looking at her, you don't guess that. She looks very, very young and very energetic. She's also an author. She wrote a book about parenting. A lot of people know her because of her acting prowess, but I think today she's recognized more from the point of her advocacy for detection, prevention, and the spread of awareness about a disease that everyone is afraid of and doesn't want talking. So, Sonali, I'd like to put my hands together. For you to do that requires rare courage, and you yourself are a television personality or film personality, and what you say makes a difference. There are a large number of doctors out here, but there are a large number of medical administrators out here, and we'd love to hear you, because you bring that patient's perspective into what is the most crucial aspect of care in medicine, and that is the quality of care, which results in better outcome. To bring a professional touch to it from a non-medical person. Mind you, other than me, there is not a single doctor on this panel. Is Praveen Nijhara. Now, Praveen, I have known as a market researcher for a number of years, over 20, 25 years. He's a Bombay guy from Narsi Monji College, and he now is the CEO of Hansa, whom you all know. And he's worked in IMR, in Kantar, and he's worked in various companies. And his work on what the patient perspective is towards different aspects of care will be worth listening to. I don't know whether Sanjay Jha is there. Yeah, Sanjay is here. Sanjay Jha, you probably saw him in Devdas. He's an actor. He's also directed a movie. He's from the Films and Television Institute. So I'm going to ask, I've asked him to answer some of the questions. Why don't films do more like what Dr. Kotnis Ki Amar Kahani or what Anand Joshi's film has done to project the positive image of medicine? Unfortunately, the image that lasts in public eye is that somebody is stolen somebody's kidney while the patient was anesthetized by the villain, and the doctors have become villains, and this image gets perpetuated because that stays. The bad news always, as Arnab will tell you, it's not when a dog bites man that makes news. It's always when man bites dog that makes news. So, ladies and gentlemen, let me begin by asking Arnab to come on stage and say his piece, and hopefully we'll still be in peace after you've finished.